Okay, should be good to go.
All right, thank you. Thank you for joining us today for the opportunity to discuss health benefit plan filings for the small group market for second quarter 2026 rates. My name is Ethan Baldwin. I'm a policy analyst with the Oregon Division of Financial Regulation, and I will be running today's hearing. This rate meeting is to discuss small group rate filings for MOTA, HealthNet, and Regions for renewals beginning in the second quarter of 2026. Small group ACA rates can have a renewal date throughout the year. This differs from individual rates which must all have a January renewal date. The small group rate filings include a time adjustment factors. The name may be different depending on the carrier, which are applied to the January rates to produce April, July, and October rates. These factors reflect the impact of inflation throughout the year on healthcare costs and are directly tied to the medical trends for the year. Next, I will turn it over to Tasha to explain the filings.
Yeah, thank you, Ethan. For second quarter 2026, we received 3 rate filings. HealthNet filed on October 28th, 2025. MOTA filed on October 31st, 2025, and Regions also filed on October 31st, 2025. Division actuaries have reviewed the rates submitted by insurers to ensure that the rate is fair, adequate, and adequate to pay claims, but not excessive. The division has made the preliminary decision to approve all the rates as filed. However, our actuaries have continued to review the filings and wait for public comment. During the meeting today, we will hear from insurers about their 2026 rate filings and division actuaries about the preliminary rate decision for each filing. Back to you, Ethan.
Before we jump into insurer presentations, I'd like to let folks know who we have in the meeting with us today from the Division of Financial Regulation. Insurers will introduce themselves at the start of the presentation. So would DFR staff introduce themselves?
Hey everybody, TK Keene, Insurance Commissioner and Administrator of Division of Financial Regulation, and pass it to Tasha.
Hi everybody, Tasha Sizemore, Life and Health Product Regulation Manager for the Division of Financial Regulation. My team includes the actuaries, and so I will pass it over to Michael.
Thank you, Tasha. My name is Michael Sink. I am Life and Health Actuary for the division and chief or primary reviewer of this filing, or these 3 filings. Next, I guess I see, is that Tim?
Yeah,
there it is.
Yeah, this is Tim Hinkle, Life and Health Actuary of the division.
And I'm Hunter McClure. I'm the project manager with the division. And I think that's it.
Awesome. Next, we'll go to company presentations. For the presentations today, we hear from insurers alphabetically. Each insurer will be given up to 10 minutes to present each rate filing. After we've heard from all insurers, we will have an opportunity to hear public comments. Since this is a second quarter filing, there won't be changes to plan offerings or networks discussed at today's meetings. So we'll start with HealthNet.
Good afternoon. I am Doug Hale, the Director of Actuarial Services representing HealthNet Health Plan of Oregon, and I am here to discuss our revised small group rate filing scheduled to first impact the second quarter of 2026. This filing reflects an update to both the base period claims experience and trend factors used in our rate development. No other major factors were adjusted. We believe this update was necessary to more accurately reflect shifts in the morbidity of the small group pool. The resulting rate impact reflects an average rate increase of 14.2%, which consists of a minimum rate increase of 12.7% and a maximum rate increase of 15.7%. HealthNet has 4,194 small group ACA members as of September 2025 that may potentially be impacted by this filing. And that concludes our updated second quarter 2026 rate submission summary.
Thank you. Next, we'll go to Moda.
Give me 1 second to pull this up and share. My name is Alex Vanos. I'm one of our managers of actuarial here at Moda Health Plan, and I oversee the team that prepares our ACA filings. So I'll be walking through our second quarter rate changes here in a minute. Let's see. How's that? Is that showing up?
We can see
Yep.
the PowerPoint. It's just not in presentation mode if you care about that. There you go.
Okay. All right. So Moda Health Plan talking 26 Q2 small group rate filing update. Okay, so with our annual submission, we requested an 11.7% rate increase for 26, which was approved as filed. The update impacting second quarter through fourth quarter is an average of 18.5%. So an increase there. And getting to kind of break that down into the pieces, but the original 26 rate filing, so that was using 24 experience with 24 months of trend. And for the update, we incremented things forward a quarter. So we're using April 24 through March 25 experience, still using 24 months of trend. And so really what we saw is if you look at that full year, an uptick in claims really the last few months of 24, and that carried forward into 25. And so if we look at the 18.5% rate increase, the year two trend that we're using in the filing is 10.4%. So that's a key component, represents a little more than half the increase. Also, that year one trend, it's 3.3% higher than was assumed in our 25 rate filing. And that's really just reacting to the experience coming in higher than expected. And then the bulk of the rest of the 18.5% rate increase, it's that experience period for April 24 through March 25 coming in higher than we would have priced in the 24 and 25 rate filings. Trying to skip forward here. There we go. I borrowed this from our annual filing. There's no changes for second quarter versus the annual, so I can kind of skip through this because we presented it in the annual. But I guess just to reiterate, anybody that might be listening into this that might have missed the annual one, kind of one big change to call out is all Moda Select plans are being discontinued in 26. Again, no difference between the annual filing and the second quarter rate filing. And that's really because enrollment in those plans has remained low, and this change only affects about 1% of the current enrollment. So in terms of the Connexus plans, that's the bulk of our membership. All plans are renewing in 26. And any Moda Select groups and members that are impacted in second quarter through fourth quarter, we'll be crosswalking them to the closest Connexus equivalent for 26, which is mostly and pretty close to some one-to-one benefit offerings. And then one of the other things we talked about with the annual filing was mid-year formulary changes. So we did see a shift mid-year 25, shift from Stelara to some biosimilars. And then another thing that's kind of a carry forward from the annual that I'll just repeat, but with the second quarter rate filing, we continue to use 2% margin for risk and uncertainty in the second quarter rate filing as well. One of the things we talked about last time was some uncertainty regarding tariffs, and really nothing's changed there. I did reach out to our pharmacy team. They're continuing to monitor things, but there's nothing concrete that resulted in an explicit adjustment in the rates at this time either. And then lastly, I'll end on our Moda Health Contact Us page. So best way if anybody has any questions about their rates or their renewal is, at the member level, they're using their benefits. Go to modahealth.com, and then I've got a screenshot here. There's a contact us at the top of the page that you'll see on the toolbar there. And then if you click on that, it'll navigate you to some phone numbers that you can get in touch with us regarding your medical benefits. And that concludes my presentation. So I'll stop sharing and turn it back over to you guys.
Thank you. Next, we'll go to Regions.
Hello, I'm Lisa Mudgett. I'm Director of Actuarial at Regions and the certifying actuary for our rate filing. I'm joined by Chris Jasperson, the lead actuary on this rate filing as well. Our biggest driver for this request to update our Q2 rates is the emerging information on the market morbidity that was available with the final 2024 risk adjustment results that came in at the end of June. Other than that, we rolled forward our experience period and reviewed our trends as well. But most other information in our Q1 rate filing remains the same. Our updated request is a 13.1% average rate change, and those rate changes range from 3.4% to 19.5%, with the highest rate changes being felt in rating area 6. Most of the driver is due to just the increased expectation on the cost of care, as well as that increase to market morbidity. No changes, as was mentioned in the introduction of this call, to networks or product offerings between Q1 and Q2, though we do all look at formulary changes fluidly throughout the year, so there are some changes there. But other than that, that is the only main difference from our Q1 rates. Lots of ways to contact us. And with that, I will turn it back over to the DFR. Thanks.
Thank you. I will now turn it over to division actuaries for a discussion of these filings and the division's preliminary decisions.
Thank you, Ethan. Since we have 3 filings today, I thought I'd go a little bit more into depth of the rate review process for these second, third, and fourth quarter filings. Typically, we will get 1 or 0 of these filings each quarter. So this is a unique opportunity to talk about these compared to each other as well as individually as a filing. So I will start with statements that apply to all the rate filings that I am discussing today. All quarterly rate filings after first quarter are adjustments to previously approved rates. This is important. The rates that we either approve or disapprove do not cancel out, or they will, if we do not approve these rates, there's still a first quarter rate filing that has been approved for these filings. So there is an increase. This is an increase on top of that increase for all 3 filings. And so I will distinguish between an already approved rate increase versus the current filing. Moda already did so, but I will repeat it for this section. For example, Health Net's first quarter filing was 9.3%. Their second quarter filing is 14.2. So approximately a 5% increase in already approved rates. MOTA goes from 11.7% to 18.5%, and Regent goes from 7.3 to 13.1. All three of these are going up approximately the same amount. Only the changes between the first and second quarter filings are subject to review. So if we've already approved a trend in first quarter and that has not changed, we do not go back and re-review what was approved for first quarter. We look at the changes, the reasons between first and second quarter that are the resulting increases in the request. So the major components that require approval are typically updated experience and new assumptions regarding trend, enrollment, and mortality. In all of these cases, the trend has been adjusted. There's mortality increases. Carriers are seeing changes in enrollment in one case, and everyone has updated their experience to the most recent, most updated. The minor adjustments, minor factors that are changed as a result of that updated experience are also reviewed, but they are unlikely to significantly impact rates. My statements in this hearing will focus only on the primary drivers of rate change. Unique to this batch of filings, the division was already aware of many of the concerns that the carriers had regarding small group rates. Several of these change requests came in at the end of the first quarter rate filing process. However, we did not have significant public comment period for people to review these requests. They were significant increases over what was previously approved. And while we did review those assumptions, ultimately we disapproved them because the public comment period was not met. That concern goes away now because we've had a public comment period for this second quarter filings, and that is taken care of. So I'd also like to make a quick statement regarding outside influences on the small group rating. It's unusual that we are talking about morbidity shifts in the small group market. The small group market has been very stable since the inception of the ACA, and these filings have not had the huge rate increases or volatility that we see on the individual side. The individual market has had several programs come and go to lure people onto the exchange or off the exchange or onto the bridge plan, off the bridge plan, that would cause some volatility on the individual side. We don't see that on the small group side, but we have identified some emerging products in this that are impacting the group market. And I did want to talk about those three. First, we have the enhanced stop loss self-funded product known as level funding. This targets groups that are really at a disadvantage. They have cheaper, healthier members. They have cheaper healthcare costs, but they pay more towards the average cost in relative to their claims than, say, some of the other groups. So they can benefit by going to this product, which is protected by ERISA and a lot of the rules of the ACA, and they get savings that way. So this is a product that targets healthy members and pulls them in healthy groups and pulls them outside of the small group market. Another one is more usage of the individual coverage health reimbursement arrangement, which allows employees to purchase from the individual market through a fund set up by the employer. That's just a shift from members from the small group market over to the individual market. So any savings that they could have been offering the small group market are now shifted over to the individual side. And the last one is we are hearing discussions about associations again that I haven't heard in several years, and that can disproportionately affect small groups as well. And at the division, we don't get to see the pricing of these other products. They're either protected by ERISA or they get buried into the individual filings. We don't get to see what the impact of these are, but we estimate them by looking at the impacts that they have on the small group market. And some of these rate impacts that I'm going to enumerate today they seem to be a result of these emerging products. Anyway, that concludes my general statements on the quarterly filings, and I'll go to each one and talk about some of the specifics. Again, these are all the same. They're all it's all experience-driven changes. So I will start with the first one, which is Health Net. The primary drivers that we located on this filing, there's a minor increase in trend of about 0.4%, but that's over 2 years period. So that's about 1% of the increase. But there's also a MLR shift. The medical loss ratio of the historical experience has jumped from 85% to 89%. And those two factors and experience are based on the emerging data. Their risk adjustment is also flipped from a positive to a negative, and these three factors are the primary drivers of their 5% increase. MODA has had a significant increase in member months in their experience. That means they're growing significantly. Their loss ratio has increased from 99% to 103%. So 3% increase there, and they've already talked about the significant increase in trend. All of this also is based on historical data, so the same issue as Health Net. And finally, for Regence has a approximately 1.5% increase in trend, but they also include a new 4% morbidity factor for these new observed rising costs, also based on historical data. So we've taken a look at these. These are not excessive. They seem to be supported by the change in their experience, and we have proposed all of them for approve as filed. Anyway, that concludes my analysis. Back to Ethan. Thank you.
Thank you, Michael. Now is the time for public comment on the rate filings. If you'd like to make a comment on a rate filing, please unmute yourself and clearly state your name and the filing you're commenting on before starting your comment. The public comment period ended December 3rd without comment. Is there anyone that would like to provide a comment? All right, I'll hand it over to Tasha for next steps.
Thank you, Ethan. After today's meeting, we will continue to review the rate filings, including the information that has been shared today, before releasing the proposed rate decision. Ethan?
Division Help for Insurance Consumers is available after rate filings are closed and the products are on the market. Division consumer advocates handle complaints and questions from Oregon consumers experiencing difficulties with insurers and insurance products regulated by the division. Advocates work with insurers to resolve complex issues and not just health insurance questions. Tasha?
Thanks, Ethan. And as we wrap up today's hearing, I'd like to thank the division actuaries, Michael, Tim, and Drew, our MC and policy support, Ethan, project management support, Hunter, our health intake analyst, Mary Ellen, division support person, Amy, division support person, Yasmin, and agency support person, Amy. And a special shout out to our webmaster, Dave Mormon, and our comms person, Jason, who continues to help us get the information out to the public. I'd also like to thank our insurer actuaries and the support within their organizations. Your presentations continue to be amazing, especially during this quarterly rate meeting. I am especially grateful at the level of detail and information provided. So with that, thank you, and I'll let Hunter into the recording.